Hey guys, how's it going? This is going to be my final presentation on the country of France. My name is Patrick Godinez, and this is for the Foundations of Public Health. So before we get started, I'm going to be covering these objectives: France's public health profile, France's public health infrastructure, environmental health, health promotion, epidemiology, and emergency preparedness and outbreaks, as well as health policy and management. So getting on to our first slide about the profile of France, I'm going to talk about some neat facts that I found and then get straight into the demographics and statistics. For the first thing that I found immediately was not only is France is Europe's biggest country, but it is especially known for its tourist attraction, which brings a lot of income and taxes. Also, France uses the currency of euros. Throughout this presentation, I've already converted the euros to US dollars. And if you ever move to or go to visit France, don't ever assume anyone there to speak English. Getting to the demographics, the population of France is about 68 million, almost, about 67.2 million. The life expectancy of individuals living in France should live around to 82 years. And the average income per capita is about 40,000. So the individuals living in France make about $40,000 a year. Per capita, 4,500 US dollars. I've already converted the euros to US, and this is how much individuals are paying for health insurance. Some statistics that I found is 4 in 1,000 children die before the age of 5, as well as adults, and 12 in 100 adults between the ages 15 and 60. This is both sexes included. And I'll be explaining some of the factors in later slides that contribute to that. Going on to the next slide for France's public health infrastructure. After World War II in 1945, France created a system which would create a national health insurance, otherwise known as Social Security. And their Social Security program contributes about 70 to 80% of that individuals, or the individuals for the general insurance plan to cover expenses. Health insurance is mandatory, and when funded is for nonprofit, which would contribute to the 5 areas of insurance. The first one being general, which contributes to 85% of the population in France. 2, independent. 3, agricultural. 4, student. 5, public service. And you can see that each of those last 4 that I mentioned are less than 25%. Independent can be for independent businesses, agricultural for farmers, students for students, public service individuals such as police officers, firefighters, and any other public servant. So continue on with public health infrastructure in France. There's also a 6th insurance plan that I did not mention in the last slide, and this insurance plan is particularly dedicated to individuals that can't afford insurance. And the way the government funds this is through taxes. As you can see in the middle, each 3 of these equally for a third of each help fund this 6th insurance that are dedicated to individuals that can't afford insurance, and that is payroll taxes, income taxes, as well as taxes from tobacco and alcohol taxes, Social Security, and other state subsidies. Continue on to the next slide with France's environmental health issues. I found 2 main problems, one being air pollution and the second being water pollution. And I'm going to be comparing Paris and Los Angeles from California. Paris is also the capital of France. So in Paris, there's a total of 2 million people, where in LA, there's a total of 4 million people. And there's a considerable size difference. For Paris, it is a total of 40 square miles, and in LA, it's 500 square miles. So considering Paris to LA, it's about 11, 12 times difference. And there's something known as the Paris smog, where I don't know if you've ever been to LA or Paris, but during the day, such as rush hour, work hour, everyone's trying to get to work, people are trying to go home, people are trying to go to lunch, and all the pollution from the cars build up, especially from the industries and companies. And solutions to fix this was the deindustrialization in industrial and urban areas. So maybe cutting the hours for the amount of time that these industries and businesses are running, as well as something they passed in January of 2017, which was the anti-pollution sticker scheme. And in the scheme, what they did was they had different colors for different cars, and such as like an individual that had a Prius would have a green sticker representing that their car was environmentally friendly, and then it'd go yellow for caution, and then a red for someone that has a really old, let's say like an old Honda. That's when you look at it, it's like already spewing. Like you can see the gas, the back like smoke that's coming out of the back of the exhaust pipe. And the individuals with different stickers, the if you had green, you pay the least. If you had a red, you paid the most for these stickers. And it was something that you had to renew each year, and it helped decrease the pollution in the air by individuals getting rid of their cars and getting something that's more eco-friendly. And in the second, for the water pollution, not only does it these industrial um, businesses affect air pollution, but they also affect water pollution. So when they did the industrialization in these industrial areas, it helped air pollution as well as water pollution. The areas that are mostly affected with polluted water now in France are rural areas such as farms that are putting pesticides, fertilization, and finding animal feces in the water. And solutions to possibly fix this is to educate the farmers on what they're doing, and also ticketing violators that aren't really cooperating with the guidelines of being eco-friendly with the environment. Moving on to the health promotion in France, where they're promoting two main problems, one being mental health and the second being smoking. For the first, beginning with mental health, the issue is that they don't really treat individuals with mental health as a priority rather than something that's a huge issue. What I mean by this is that they think individuals with mental health issues should go to the hospital and take a pill in order to get this fixed. Um, they create stigmas that it's in your head. It's something that's not really a problem. Although it's not really in France that this is a common problem, but throughout the U.S. as well. Um, in a cross-sectional study that I found with almost 3,600 individuals, about 17% of them had a mental health illness. And later in the study, it explains how almost all of these individuals, 3,600 people, had some sort of mental health illness, whether it be very minor to severe. A solution of this is educating the community and explaining that mental health illness is something to be taken seriously and not taken lightly. The World Health Organization is collaborating with the Center for Research and Training in Mental Health in Lille, France, and helping promote and provide resources for the community and help explain that mental illness is something to be taken seriously. For the second issue, which is smoking. In 2005, there was about 30% of the population in France that were smoking, which increased to 34.1 in 2004, and then decreased to 22% in 2015. This is still the highest percentage of smokers in Europe, and France is not only the biggest, but has the highest amount of smokers in Europe. The solution of this was from the decrease to 2014 to 2015 was increasing the tax on tobacco and raising awareness of health issues from smoking. Not only does this tax prevent people from smoking, but it also provides more funding towards health insurance, especially that sixth healthcare plan for individuals that can't really afford it. Moving on to the next slide for epidemiology, emergency preparedness, and outbreaks. So in the event that a disaster or some kind of outbreak would happen in France, there'd be two levels of assistance, would be globally and locally. Globally, WHO, which stands for the World Health Organization, and EESC, which represents emergency and essential surgical care. They have partners throughout the world that would assist countries the in the event that something happens. And these partners would provide resources and assistance as well as locally. For locally, this would be the locals, the volunteers, donators, as well as the partners from WO that would help provide resources and assistance. In France, there is also a French Red Cross, which I have a picture in the top right, and as well as other programs and departments such as their emergency services, fire department, police officers that could help assist individuals in a crisis. WHO also keeps track on diseases and outbreaks and giving detailed reports on bacteria, viruses, and etc. An example of this was when France notified the World Health Organization back in 2019, I believe in January, of 5 cases they had of Rift Valley fever. Rift Valley fever is rare, but it is cross given through animals and humans. And when women get this and they're pregnant, it usually causes, unfortunately, miscarriages. And for children and individuals that are sick or elderly, it causes them to, unfortunately, causes death. Moving on to the health policy and management in France, as I mentioned in the very beginning with health spending per capita, which means that the amount that each individual is paying for health insurance. And as you can see in the very top, the United States leads in spending per capita and is about in the middle range for GPD per capita. Or as I drew the little line for France, representing I believe about 400 compared to U.S. where they're paying close almost about 10,000. To the next slide. To the final slide, this is a continuation of the health policy and management, and recapping the health income per capita, which is about $40,000 that individuals in France are making, and per capita it was 4,500 US dollars. I did the conversion between euros and US dollars, and 4,500 is how much is put towards these plans for health insurance. Although the French healthcare system may seem more expensive, when it's compared to the US, they're paying about 8,500 US dollars for their healthcare system per capita. The health expenditure as a percentage of GDP, France is at 11.6, whereas the US is at 17.7. The difference between the US and France is that the healthcare systems allow for individuals to go where they want and get the treatment that they need. Whereas in the US, if you tried to go straight to, say, in the event that you needed surgery on your elbow, you wouldn't be able to go straight to a surgeon. You need to see a doctor first and get a referral. Whereas if you're in France, you're able to go straight to a surgeon and speak to them as a consultation and get that taken care of. But in the event that you saw a doctor and got a referral, then there would be benefits towards that, and your healthcare plan would cover more than just going straight to them. Also, another thing that I noticed was for the healthcare system in the U.S., if you try and go and see a psychologist or get physical therapy, insurances won't really cover that. But in France, you can pretty much get anything covered. You can go and see a psychologist, a therapist. You can try new drugs, experimental drugs to get treatment, physical therapy or orthopedic therapy, and make doctor's appointments. A very interesting fact to wrap up this slide is co-payments are waived for individuals with chronic health problems, and this means that the individuals that would with chronic problems such as cancer or any disabilities that require them to go and get treatment constantly, they almost reap the benefits more because that's just how the French system created this program. And that wraps up the end of my presentation. Thanks for listening. These are my references.